Hi, I'm Sherri Gallant with Alberta Health Services. Welcome to Health Matters, and thanks for joining us today. On today's show, I'll be talking to two women about an important event happening later this month downtown in Lethbridge at Gallant Gardens. And if a new baby is in your future, you'll want to stick around and hear what's new in prenatal and postnatal programs in the South. Further to that, we'll learn about the awesome services at the Lethbridge Public Library and find out how to access them. First up, a unique event is taking place at Gallant Gardens in Lethbridge later this month. Treena Tallow is an advisor with AHS in Aboriginal addiction and mental health, and Heidi Davis is a recreation therapist with AHS, also here in the South Zone. Treena, can you tell us a little bit about this event, please?
So we're definitely excited for September 23rd. We're coming together as a community to hold our first ever reconciliation pop-up clinic in Powwow. So this event is going to be held downtown Lethbridge Gallant Gardens and features a one-day competition powwow that will run from 2 to 8 with the grand entry at 2:30. So bring your lawn chairs and get ready for a full day of action and getting healthy together. So our target for this event is Indigenous families. However, everybody is welcome. So the pop-up will run approximately 2 to 5 with some providers staying till 7. The pop-up clinic will feature multiple service providers coming together to offer a variety of health and wellness interventions and education that serve to address the Truth and Reconciliation Commission and the missing and murdered Indigenous women's calls to action. So we're really excited about this event. This event is really meant to attend to those calls to action. So this pop-up is going to feature local and provincial service providers delivering healthcare services and interventions in one place at one time. And these will include like cancer, liver, kidney screening, just to name a few. So the event will really demonstrate a different way of working together as a community with a focus on relationships. So as you know, the pandemic has really burdened people's personal health, and this pop-up clinic will serve to re-engage people back on their healthcare journeys. So we're really coming from an ecological approach with this event. So we're really looking at community, starting with community, meeting people where they are, and we're turning nobody away. So at this event, we're really emphasizing principles of cultural safety and cultural competency. So we know that healthcare really is a sacred trust, and making meaningful connections within those encounters is key. So we base these connections on our value systems. These value systems mean many things to many different people. However, from our Indigenous perspective, we call these our Nitsitabi relational responsibilities and accountabilities. So from the Blackfoot language perspective, we try to embody things like Gimabibitsin, which is connecting from the heart through kindness, or Spomotsitsini, which is finding ways of being helpful to one another. So we're really coming from these foundations with this event. Like I said, our focus is really on relationships. We seek to transcend from a typical healthcare encounter to one that is based on trust and connections. So I guess I like to come from a philosophy of connecting from the sacred or communicating from the sacred. And what that really means is engaging from the heart, making strong connections, and especially listening with love. So these are the values that are universal, and they serve to connect us with any sacred trust that we are gifted. And this is an event that will bring us all together and connect us in ways that we've never connected before.
What I'm hearing is meeting people where they are instead of having them have to seek out care. That these services and this event brings everything to sort of the heart of the city where people can access it easily. Is that correct?
Yes, I think Heidi's going to address some of that
Oh,
part. Yeah,
fantastic. Okay.
we've,
And
we've organized it that way.
I understand that the date you chose, the 23rd of September, is very close to a
Yeah.
significant day at the end of September. Can you explain?
Sure, I can. So, as you know, September 30th was recently recognized by Canada as the National Day for Truth and Reconciliation. So this event will be kicking off the 6th annual Reconciliation Week here in Lethbridge. So what that is, so Reconciliation Lethbridge, or we call it RLAC, in collaboration with the City of Lethbridge, dedicates the last week of September for Reconciliation Week. So every year at this time, the community comes together to observe reconciliation efforts by ways of acknowledging the past or by uniting us in a better future, I guess I would say. So in the spirit of reconciliation, we're all coming together. This is a city coming together in different ways that we've never seen before, collaborating with partners, with RLAC, Alberta Health Services, United Way, Interfaith, Food Bank, Lethbridge Ports Council, City of Lethbridge. Volunteer Lethbridge is going to be sending volunteers to help support the program, as well as we have donors that are coming forward and donating money towards the competition. So it's really a community allyship with a broad range of service providers all coming together for this event. So we're really, really excited about it.
Heidi, has this event ever been done before, or is this something brand new and unique?
Yeah, so this is the first time the pop-up has taken on this shape and had the powwow element to it. We are standing on the shoulders of giants with work being done over the last number of years, the Impact Initiative and various pop-up clinics that have been done in the past in Lethbridge. Treena and I were both part of all of those initiatives. But this is the first time it's being held outdoors at a park with that intention of reaching that underserved population in the best way we can. There are initiatives that are happening in the city and there's amazing outreach work being done. But to come together and do it in a collective way is really a unique opportunity. Even coming for part of the experience, the powwow, the music, the singing, drumming, whatever is going to be happening at the park, it up levels the ability to provide care regardless of what your role is in our city. So those experiences are also part of the calls to action. So Treena's put together quite a group of stakeholders, and it's a unique offering in that way, and we're excited to see how it's received in the community.
So I was going to ask you, why is it being held downtown in the park? But I think you really just answered that.
Yes, and I think having an event happening in the park shows a land-based perspective. It shows a willingness to reach people where they're at, just like Treena described. But we know that a lot of our underserved population, people who have difficulty accessing healthcare in a traditional setting, in a brick and mortar facility, this is a way of building some relationship. And the service they require might not be available in the park, but the initial conversations are available. And our job might be to come down there and to listen. Our job might be to connect them where it's necessary, but that initial conversation has to happen really organically in a safe and an approachable way. And so what a beautiful place to do it outdoors in the park, and the community can come together in a different way. And when you hear the drums, when you see the dancing, when, maybe it's one person's receiving care, but their family member is being supported in conversation, there's some really nice things that can happen. And we haven't had that a lot with COVID, especially in facilities.
It just sounds so exciting, and it's ambitious and important, and really exciting. I thank you for taking the time to come and tell everybody about it today, and I really hope you have a massive, huge turnout. Well, parents getting ready for their first baby have so many questions leading up to their new arrival. And my next guest can sort of be coming to the rescue, I think. Tammy Gamracy is a registered nurse, and she practices within public health. She's the team lead for both the prenatal and postnatal programs within the South Zone. Thanks, Tammy. Welcome. Thanks for being with us.
Thanks, Sherri.
What are the pre and postnatal services in the South Zone?
So the pre and postnatal services consist of both prenatal and postnatal classes. So our prenatal classes are recommended for pregnant individuals who are in about their third trimester of pregnancy, as well as their support persons. And then the postnatal classes are recommended for parents with babies between the ages of 6 weeks and 3 months of age. Of course, we often take them a little bit younger or a little bit older, but that's just seems to be a really good window for postnatal classes. We're really excited to have these classes back because it was a long 2.5 years that we weren't able to have that. And so this is just, we're so happy to have this.
I'll bet. It's it will be so nice to have people together in person to ask questions and form bonds. What kinds of things will they be learning?
So for our prenatal classes, really those are just a really great opportunity to meet other people in your community who are also experiencing or who are also expecting a baby. You'll gain knowledge of what to expect during your labor and delivery, early postpartum, any sort of questions about your pregnancy, your diet, your childbirth plans will also be answered. You'll discover what resources available for yourself, for your support person, as well as your newborn. For the support person, they often come away gaining a lot of confidence and tools needed to really be effective support, effective in their role as a support. And for our prenatal classes, we actually focus both on the birth process as well as the early newborn experience. So it's about a 50-50 split between that prenatal experience and that early postpartum experience. So some of the things some of the topics that we include are physical and emotional changes in pregnancy, healthy lifestyle choices for you and your baby, getting ready for birth, so things like decision making, common discomforts, challenges, coping strategies. You'll also learn about newborn postpartum care, breastfeeding, formula feeding, diapering, calming a baby, bathing a baby, caring for that baby. We also spend a lot of time talking about the realities of the postpartum adjustment period, and coping strategies for that as well. Basically, that life balance after having a baby. And then often I find after taking prenatal classes, clients report that they feel less scared, less anxious. Their support persons also comment on how much they've learned and how much more confident they feel in their role as a support person. And I actually just finished a series a couple of weekends ago, and I had a young support person say, you know, I didn't think I needed to know anything about having a baby since I wasn't the one having the baby. But I've learned so much, and I'm so glad I went to this. And he said, I'm so ready for this baby now. So it's great feedback to have that for those support people.
Oh, that's the best feedback you could get.
Yeah.
So once that baby is here, then what are postnatal, or you call them baby steps classes?
Yeah, so it's sort of an interchangeable name. So our postnatal or baby steps classes are again a wonderful way to just have a safe place to connect with other parents, to share your mutual concerns and experiences. The class is in a really quiet place with big, comfy rocking chairs. It doesn't really matter if your baby cries. It doesn't matter if you haven't slept. It doesn't matter if you feel exhausted. In fact, we encourage our parents to come especially on those days. So we really, really make a big effort to make those classes just feel safe and secure for new parents. Those postnatal or baby steps classes are facilitated by a public health nurse. So you really receive a lot of evidence-based information from professionals about caring for yourself and your baby. And again, it's a really safe space to openly learn and share about all of the new challenges that come with having a new baby. And these groups often, just that early period of being a parent, being a new parent, tends to bond people quite quickly. So a lot of our postnatal groups stay together even after the series ends. And even just on a personal note, I had a baby group with my now 18-year-old daughter, and we actually just celebrated our 18-year-old baby's birthday. So it definitely, that bond can last for a long time. Some of the topics that we include in these postnatal classes are parenthood and parenting skills. We talk a lot about maternal physical health, including pelvic health. We talk about mental health, and in fact, we normalize a lot of taboo topics in this area. So we talk very openly about the ways that parents can struggle with mental health, as well as what to do about it, how to cope with that. We talk about infant communication, sleep and crying are very big topics in baby steps classes. We talk about infant illness, nutrition, dental, development. We also talk about baby wearing, car seat safety, and again, we focus on relationship adjustments. Lots of different professionals in the baby steps classes also help provide input. So in addition to that registered public health nurse, we also have registered dietitians, pelvic floor physiotherapists, infant brain development advocates, dental hygienists, health promotion, car seat technicians, as well as occupational therapists, speech pathologists, and behavioral specialists.
Wow, you really have it all covered. I mean, it's been many years since I had my children and my classes, but they just sound better than ever. That's amazing. Where are they being held, and how can people sign up?
So currently, both Lethbridge and Medicine Hat are offering in-person classes. We're hoping that Brooks will get going pretty soon, as soon as we have staffing available for that. So finding out where and when to sign up for classes, first thing is you can just go to ahs.ca/prenatal. Make sure you click on the Self Zone tab. Often clients will go into it and not realize that they're on the South Zone or the Central Zone or the North Zone. So ahs.ca/prenatal, click on the Self Zone tab, and there you can register for either prenatal or postnatal classes in Lethbridge or Medicine Hat. And the cost is $40. And of course, subsidy is available. So if that isn't feasible for you, then don't hesitate to call. You can call 403-388-6668, and we can have that cost covered right away. So in Lethbridge, those prenatal classes are available currently Monday or Thursday evenings from 6 to 8:30 p.m. And we also have a weekend series available if the week nights don't work for you. Every third weekend, we also offer a Saturday, Sunday series from 9:15 to 3 p.m. And for the baby steps classes or postnatal classes, those run in a 6-week series every Tuesday, Wednesday, or Thursday from 1:30 to 3:30 p.m. And if you live in the Medicine Hat area, those prenatal classes are on Wednesday evenings, and the baby steps classes are Monday afternoons.
Thank you, Tammy, for everything that you do. It's so important, and all the best. We wish all the best to all the new parents out there.
Thank you.
Stay with us. We'll be back in just a moment. Welcome back. Well, it was Albert Einstein who once said that the only thing you absolutely have to know is the location of the library. And J.K. Rowling said, when in doubt, go to the library. Well, Paige McGeorge is with us today. And as a Teenbrarian at Lethbridge Public Library, she's got the goods on why all of us should really be connected with this central source of knowledge. Welcome, Paige. I know it's hard to believe that some people haven't been in the library, so we're going to tell them why they should be. But first off, can you tell us what a Teenbrarian is?
Sure. So as you mentioned, I'm the Teenbrarian for Lethbridge Public Library, which means basically I get to do all the fun stuff. I work with the teens who come into the library and who are around the library in our community here of Lethbridge. I do programs, I build the collections for them. And for us, that's anywhere between grade 7 through grade 12, about ages 13 to 17.
That sounds like a boatload of fun. Can you give us, I know this is, it seems to me like a really giant question, but can you give us an idea of what Lethbridge Public Library has to offer?
Sure. So we have something I like to think for absolutely everybody, both in our collections and in our programs. We have programs for families. So if people are looking for something to do with their littlest kids, the preschoolers, the babies, we have story times in the mornings at both of our branches. We have programs for school age kids where they get to explore science and art and nature and stories. I get to do the teen programs. So we do everything from Mario Kart on the big screen to book clubs and leadership groups. We do lots of projects with other ages, and mostly we just have a really great time. For adults, we have book clubs, we have movies in the evening, we have all sorts of really interesting educational and entertaining programs at both of our locations. And the neat thing is we also go out into the community with our bookmobile, which visits all over the city and takes both collections and, again, programs. Especially in the summer, we set up big tents in parks and do crafts and stories and have a great time with the community.
Paige, that is amazing. So how can people who haven't been familiar with the library go about accessing all these services?
Well, whether you're new to the library or you're a returning member, one of the nice things that we have set up now is you can access our services and collections both in our branches as well as online through our website, which is lethlib.ca, lethlib.ca, or just search for Lethbridge Public Library. If you don't have a library card, come see us at one of our service points. We can set you up with one, or you can fill out a form on our website and immediately, if you live in Lethbridge, get a barcode and a pin set up so you can access our ebooks and audiobooks like that. The nice thing, again, for our memberships in 2022 is through December 31st, all our memberships are no charge. You can come in, you don't have to pay anything for your library membership, and you get to access everything we have. The other great thing that we've started recently is we are now a fine-free library, which means that if you keep something a little bit longer, you need another, couple days to finish a book, we're not going to charge you overdue fines. What we want is for the material to come back for the next person to use it. So whenever you're done, bring it back and there will not be any fines on your account.
That sounds sensible to me, because I would imagine that if there's shame attached to an overdue product, people might just not want to show their faces. So that's quite wonderful.
Yes, library fines are scary things. And if we can remove that barrier to people using the library, we're happy to do it.
Cool. What's new? What else is new at the library that people might not be aware of?
I think we have a lot of things that people might not expect a library of the past to have. We are now kind of a library of the 21st century. So we have lots of really neat things in our collections. We have video games, we have comics, we have magazines, all of which you can borrow and take home to use. We have spaces that you can use in the library for meetings or hangouts, or a computer lab at the Crossings branch that you can book out to play video games with your friends if you want. We have lots of different things for all different ages. And there's really, like I said, something for everybody and something unexpected that you may not know that you need.
So it's well worth checking out. I mean, I know people who are using the library already know this magical place, but well worth investigating if you don't. Thank you so much, Paige. I hope you start to see some new faces there very, very soon.
We are always happy to meet new friends and have new people in our spaces.
Well, that's it for another edition of Health Matters. My thanks to our guests today, Treena and Heidi, Tammy and Paige. And as always, if you would like any more information about Alberta Health Services programs and services, please visit our website, ahs.ca. Thanks. Please come back and see us again soon.